Helen Smits is a global healthcare advocate and policy shaper who has devoted her life to securing quality medical care for the most impoverished. Guided by her conviction that we must not be indifferent to suffering, Dr. Helen Smits has fought for better healthcare standards in the United States and in Africa. Helen was born in Long Beach, California, to parents who were both professional writers.
I grew up in a household where writing was the only respectable way to earn a living. I actually went into graduate English before I sort of looked back at my decisions and decided that medical school, which I'd wanted as a child, was the right thing for me. Yale Medical School was, I think, a very good place to be in the 60s. There were 8 or 9 women in my class.
In 1971, after a residency at the Hospital of the University of Pennsylvania, Dr. Smits was appointed chief resident.
Helen was an outstanding intern and resident. And so when I came there, she already had a great reputation. I got to know her work well, and I and my associates decided that she would make an ideal chief resident. And by the way, she was the first woman to be a chief resident in the long history of the University of Pennsylvania.
Helen Smits rose through the ranks and was promoted to the position of Associate Administrator at the Hospital of the University of Pennsylvania. She also joined the faculty at the Wharton School, where she met and married her husband, Roger Lecomte. 3 years later, they welcomed their son Theodore into the world.
After that, the big jump for me was that I was asked to take a political position in the Carter administration, and I was asked to be the head of the Health Standards and Quality Bureau. We began to put in place processes to ensure that decisions inside of Medicare were made with the best scientific medicine.
In 1981, Helen Smits moved with her family to Connecticut and joined the Yale University faculty. After several years, she took a position at the University of Connecticut Health Center, where she became the director of the John Dempsey Hospital. While at UConn, Dr. Smits served as a member of the Board of Regents of the American College of Physicians. She served as that board's representative to the Joint Commission on Accreditation of Healthcare Organizations and was eventually appointed chair of that commission, the first woman to ever hold that position.
She is a leader among men and women. And if you watch Helen, her courage, her confidence, her clarity, her willingness to speak up, you see a model of leadership for either gender.
In 1993, Dr. Smits was called to Washington, D.C. for a second time, this time by President Clinton. For this administration, Helen was appointed Deputy Administrator and Chief Medical Officer of the Healthcare Financing Administration at the Department of Health and Human Services. Secretary Donna Shalala then chose Dr. Smits to oversee the review of the clinical center at the National Institutes of Health.
And Helen was deeply interested in improving quality and had a major impact on national policy that was looking for ways to support better quality health care. She was a major player in that scene, and she deserves a lot of credit for what she did.
I think it was a really remarkable experience to work on Hillary's health reform. It really got further than any other effort to reform healthcare in this country has gotten. It got out of committee and onto the floor of both houses.
At a time when most people would be thinking about retiring, Helen instead chose to embark on a new journey, halfway across the globe.
When we went to Mozambique, I was a visiting professor at the medical school in a brand new program in public health.
Nothing stops Helen. In her early 60s, moving to Mozambique as if it were moving across the street, setting up a household with her wonderful husband in Maputo, and then becoming a major figure in helping that country along.
After I had been in Mozambique for a year, the Clinton Foundation arrived to work with government on preparing an AIDS plan. And we had a chance to work together on the Mozambican AIDS plan.
In 2005, Helen Smits was appointed co-chair of the Institute of Medicine's committee to evaluate PEPFAR, the President's Emergency Plan for AIDS Relief. Her highly regarded expertise resulted in Dr. Smits testifying before Congress.
When she helped shape and guide the Institute of Medicine's amazing project to evaluate the PEPFAR program, you could see her expertise, the way she thinks about evaluation come through. She's a real master at that.
The really exciting thing about Mozambique is that their AIDS program has been very successful. I believe it's over 75,000 on their way towards 100,000 in treatment. That's really remarkable.
There are many themes to Helen's work, but one of them is a constant mindfulness of disadvantaged people, whether they're in our country and we're dealing with issues of equity and justice and closing the racial gap in health status. And even more so, perhaps globally, Helen is a passionate advocate for the poorest nations and the poorest people.
Dr. Smits' work as an influential healthcare advocate in Africa has literally saved thousands of lives.
She's admired for her skill as a policymaker and leader in the world of healthcare from the federal government perspective, one of the real experts on American public health policy. She understands medical education, has been a major contributor to thinking about the development of education, especially in developing countries. She's a global health specialist. She is amazing.